The Hispanic population is a fast-growing population within the United States. This population is also one of the most underserved within healthcare, whether due to the language barrier providing poor information or due to the Hispanic cultural beliefs of holistic medicine with the use of herbs, prayer, and superstitions as their primary form of healing. Modern medicine is usually a last resort regarding treatment options. This presentation will highlight these cultural beliefs when caring for the Hispanic patient and will provide insight from the childbearing woman to the growing child, through adulthood, and all the way to the elderly. This insight will assist clinicians in how they approach and care for the Hispanic patient. The Hispanic population is expected to reach 97 million by the year 2050. With this population growing so rapidly, it is important for clinicians to understand the Hispanic culture in order to better care for these patients. An understanding of the family role, religious beliefs, and their impact on healthcare, as well as general practices when caring for the sick, will provide a basic comprehension of this culture and allow a more compassionate approach when caring for these patients. Morales et al. Stated that cross-cultural miscommunication may occur when a Hispanic patient mistakenly perceives impersonal professional behavior for lack of interest, or when a physician unfamiliar with Hispanic patients perceives Hispanics to be superstitious, present-oriented, non-compliant, or uninterested in preventive exams. This statement is very definitive with regard to the lack of understanding of other cultures and how messages can be misconstrued based on body language and cultural beliefs or misconceptions. Hispanics are primarily of the Catholic faith and believe that sickness is a punishment from God. A more holistic approach toward healing is the preferred course for treating illness with the use of prayer, herbs and teas, candles, amulets, and the use of the hot and cold method. The hot and cold method refers to the belief that some illnesses derive from heat and some from cold, and that the balance of hot and cold within the body will promote health and prevent illness. Using counteracting temperatures depending on the illness will assist in healing and return the hot and cold balance. For example, if a patient is suffering from a cold illness, they would require hot foods and drinks to counteract the illness and promote healing. A curandera is a healer who focuses on physical, mental, and spiritual health as a whole. Treatments will include prayer, penance, offerings, and the use of herbs and teas. Childbearing is considered a hot illness, and the woman should be given cold items such as ice, cold drinks, and cold foods to soothe her during pregnancy and delivery. Hispanics are very private, and matters dealing with the pregnancy and the woman's body should not be discussed in front of the husband or male children. During childbirth, the mother is the primary caregiver and tends to the needs of the woman and newborn, and the husband traditionally won't see the woman and newborn until they have each bathed and are dressed. The social status of a Hispanic woman is based off of how many children she has, not on material objects, and birth control other than natural family planning is unacceptable. Acculturation from a person's Hispanic country of origin can possibly have negative health responses. For example, if a person didn't smoke or drink in their country of origin, but saw it as a norm in the United States, then they may take up drinking or smoking in an effort to fit in. Low-income families won't be able to afford high-quality foods and will be forced to purchase more processed and higher-fat foods, leading to obesity. Studies have shown that Hispanic children aren't very active and that this could be a contributing factor for being overweight. That being said, Hispanics see body image differently than Americans. They see plumpness as the ideal body image and thinness as being sickly. The evil eye is a common Hispanic superstition relating to babies. If someone gives a baby a compliment but does not touch the baby, it is believed to be a curse and the baby will become ill. Hispanic men are considered the disciplinarians and providers, while the women are the nurturers and caregivers. If a Hispanic man is sick, it is expected that the women will dote upon him. The elderly in Hispanic culture are held in high regard. Whenever someone is sick or seeking advice, they turn to the elderly for guidance. Elderly women are seen as role models for the women and young girls in their families. Hispanic families tend to live in close proximity to one another and in areas that are more populated with people of their culture. Hispanic cultures emphasize family interdependence over independence. In summary, and to generalize, there are far too many cultures mixed in the United States for everyone to know everything about all of them. A basic understanding of the cultures of our patient population is better than not taking the time to know any part of them. It shows more compassion on our part and confirms a level of trust that wouldn't have been there otherwise. By not learning about a patient's culture, we risk potentially offending someone or providing poor information, which could lead to poor self-care once the patient goes home. It is better to take the time to learn and become more culturally competent in order to provide more culturally sensitive care.